Hi everyone, this is Dr. Bill with Ez2Passnclex, Ez2Passnclex.com. This session, I'm going to be reviewing meningitis. What is meningitis? So meningitis, ideally, is inflammation of the brain, usually the meninges, caused by infection. It can also be, risk factors can be related to trauma. Sometimes people with or found in high population or dense areas, babies, newborn babies are at risk for meningitis. So what happens when somebody develops meningitis? Basically, infection can lead to the brain either swelling, which can lead to potentially seizures. That becomes a risk factor or a concerning issue for meningitis. So when someone is diagnosed for or with meningitis, what are some classic signs and symptoms that you're going to be seeing? Fever, chills, headache is classic, and stiff neck, also known as nuchal rigidity. So usually when you assess the client and you instruct the client to do the chin to neck or chin to chest tilt like this, they have a very rigid outcome, so they're not able to, or it hurts. That's a classic symptom for meningitis. They can also have anorexia and vomiting with that. So with these signs and symptoms, how do we diagnose meningitis? We can identify it from cerebrospinal fluids. It can be obtained through lumbar puncture. So the client will go through a procedure called lumbar puncture, where they tap the spine to withdraw some fluid and test the fluid for glucose or infection. The infection could be viral or bacterial, so it all depends. The difference is that with viral, it can be self-limiting or it can resolve by itself. But then with bacteria, it's the most debilitating or serious one. So the client must be started on antibacterials right away. So what do you do as a nurse? What are some nursing interventions? Safety. You want to anticipate seizures, so mainly implement your seizure precautions and maintain it for at least 24 hours after antibiotics are being started. Place the client on isolation. Place the client on isolation and use your strict isolation precautions, and try not to cohort clients together, especially client with viral versus bacterial. Do not cohort them together. You can only cohort the same organism at the same time. Okay. Administer antipyretics such as Tylenol to reduce fever. Hydrate the client. Assess for changes in neurostatus. So you want to assess the client for changes in neurostatus. Assess vital signs, monitor nutritional status, and hydrate the client as much as possible. And also monitor for signs of or changes in intracranial pressure. It can lead to increased intracranial pressure, so monitor for those signs. And I will cover intracranial pressure in another topic, so please continue to follow me. Education include getting the client vaccinated, pneumococcal, the hip vaccines, or the meningococcal vaccines. And remember, keep the client safe as much as possible. So that's it for meningitis. Thank you, and follow me at Dr. Bill at Ez2Passnclex.